Well, based on our population size and the modeling that we did already, we expected to have, based on the modeling, which is a 35% attack rate with a 12-week period of outbreak, we would expect to have over 15 or 1,600 persons infected. And out of that, we'll expect to have about 128 persons admitted over that 12-week period, that 3-month period. And out of those, there may likely to be, based on modeling, this is not exact science, but this is modeling, we expect to have about 28 deaths.
That figure is a ghastly outline of what medical professionals predict if swine flu reaches the Turks and Caicos Islands. The endemic has already been charged for more than 100 deaths in Mexico and a number of outbreaks in the United States and Europe. Director of Medical Services Dr. Rufus Ewing and Minister of Health the Honorable Royal Robinson yesterday announced the Ministry of Health's plan of action for the Turks and Caicos Islands and announced that we are in an advisory state, that residents should avoid mass gatherings, stay away from nightclubs or bars, and restrict travel to countries that have reported the swine flu outbreaks. In the afternoon press conference, both officials advised media personnel that they are heightening their levels of alertness and are urging residents to take precautionary measures to prevent the spread of the virus.
The Turks and Caicos Islands Ministry of Health has already approached the situation in a proactive manner. Meetings with the Communicable Disease Surveillance Committee and Providencialis and Grantor have been held by Dr. Rufus Ewing, DHS Chairman, and a plan of action devised. Further meetings will be held with key stakeholders such as personnel from disaster management, Red Cross, emergency services such as police, fire, healthcare providers, GIS and other media houses, customs and immigration, tourist board, and various airlines and airways.
Turks and Caicos Islands medical professionals, immigration personnel, and flight workers rallied together yesterday to discuss possible precautionary measures to be taken at the local and international airports and seaports. There were also discussions about measures to be taken for incoming tourists and returning residents.
We have already implemented enhanced surveillance at the Providencialis International Airport, where all passengers disembarking aircrafts are required to complete a health questionnaire. These persons will be screened by medical personnel and triage. Any person suspected of having any respiratory illness, cough, fever, or any flu-like illness will be triaged, assessed, evaluated, and determined whether or not they should be isolated and diagnosed and tested to have the diagnosis of swine influenza confirmed. We are going to heighten our surveillance at the port for all persons. We're not going to discriminate. But however, there are persons who are coming in from the epicenter, Mexico, because Mexico have a different epidemiologist thus far, because the most severe cases were from Mexico, and that is the city that has the highest fatality. And so we know that there are persons who, workers, who are from Mexico residing among us and probably travel backwards and forwards via the Dominican Republic and elsewhere. And we will be heightening our surveillance of those persons.
The medical department is currently spearheading surveillance operations of persons who may be experiencing flu-like symptoms. Dr. Ewing informed News 4 that there are currently no cases of swine flu in the TCI. However, the Department for National Disasters will take over the operation if there is an outbreak.
All persons who are suspected of having swine influenza will be directed to have laboratory confirmation at least for the first week, all persons. But we know there are lots of resources involved in testing each and every case of acute respiratory illness. But we want to know what our epidemiological viral profile is for the first week, so all cases will be tested. After that, we will decrease the number of tests of persons coming with respiratory illness once we have gotten our profile.
So far, the United States Center for Disease Control has confirmed 64 cases of the virus in the U.S., including New York with 45 confirmed cases and California with 10. The state in the nearest proximity to the Turks and Caicos Islands, Florida, has not reported any cases of the swine flu. According to the CDC's website, symptoms of swine flu include fever, cough, sore throat, body aches, headaches, chills, fatigue, diarrhea, and vomiting. Swine flu can be spread between humans through coughing or sneezing of infected people and touching something with the virus. The origins of the strain remain unknown. However, swine flu continues to be more rampant in Mexico. Flights in and out of the country remain ongoing. News 4 will continue to follow the story as it develops. For WIV4 News, I'm Angie Toussaint.